Good evening from New York. Either the Senate is on its way to what Governor Howard Dean today called the best and perhaps only way to get a public option of some form through the Senate, or Democrats in that body are on their way to possible revolt. Our fifth story on the countdown, conservative Democrats seeming to warm quickly today to what's being called the opt-out public plan, which would allow the individual states to not participate in a national public plan if they decide against it. Meanwhile, 30 other Democrats still fighting for a full public option, some taking to the floor of the Senate to demand just that. Presently, we'll be joined by one of those latter Democrats, Senator Wyden of Oregon. But we begin with the latest details. Majority Leader Reid announcing today that the Senate Finance Committee will be voting on Tuesday on its bill that would deliver millions of new paying customers to private insurance companies at government subsidy expense, with no public option, at least not now, to control their ability to deny liver transplants and raise premiums at will for anything you can think of that might be wrong with you. Some senators now discussing ways to fix that. Senators Schumer and Carper floating that opt-out public option proposal. An aide for Senator Baucus telling TalkingPointsMemo.com that the chairman of the Finance Committee, quote, will look closely at the proposal and could consider supporting it. Senator Ben Nelson of Nebraska telling Politico he likes the idea of leaving the decision up to the states. But why would an optional public option make any difference with red state Republicans, already saying they are unlikely to vote for a bill that would reduce the deficit by $81 billion over 10 years because it costs too much and because it would hurt the insurance industry, their real constituents.
Here's where I come down. It doesn't take into consideration that practically every one of the 85% of the people who have health insurance, it's going to increase their premiums because you see the tax on insurance companies is going to be passed through. It's just natural that it'll be passed through. And then don't forget it's partly paid for by creating problems for senior citizens by taking $444 billion out of Medicare.
The Republican leader of the Senate, Mr. McConnell, further promising that the Baucus bill, quote, will never see the light of day. Meanwhile, Senator Brown of Ohio and about half a dozen other Democrats taking to the floor of the Senate tonight to demand a public option, a real public option, one that is not seen as the third rail of health care reform. Time now to be joined by Senator Ron Wyden, Democrat of Oregon, member of the Finance Committee. Thank you greatly for your time just now, Senator.
Thanks for having me, Keith.
As we just mentioned, some of your Democratic colleagues tonight having taken to the floor to demand a real public option in that bill. You and 29 of your colleagues have written to the Majority Leader today urging him, quote, to fight for a sustainable health care system that ensures Americans the option of public plan in the merged Senate bill. What's standing in your way? Why has this, in fact, become the third rail of what a majority of Americans want and an overwhelming majority of Democratic lawmakers want to make it happen?
Keith, we are taking on the status quo caucus, and it is led by the insurance companies, and they don't want the American people to have real choices. Look, I'll be real clear about what I want. I want to make sure that hardworking Americans aren't forced to buy lousy, unaffordable health insurance from monopolies. We shouldn't subsidize the wrong people to do the wrong stuff. We ought to make sure that all Americans have choices, public choices, private choices, so we can turn the tables on the insurance lobby and get a square deal for the public.
Senator, the flavor of the month, or at least the day, is this opt-out plan. Is this really a silver bullet, or is it another way to make sure there is no actual public option?
I don't see how it puts the consumer in the driver's seat. I want all consumers to have what members of Congress have. You said something very powerful last night, Keith. You made it personal. You talked about your situation with your family, what people who are well off can have. Well, members of Congress are well off. They can have access in Washington, D.C. to more than a dozen good quality policies. They can't discriminate against you. They can't cherry pick. They have low administrative costs. I want to make sure that all consumers get a fair shake. And these opt-out ideas, at this point, I don't see them turning the tables on the insurance lobby.
Senator Grassley, as we heard a clip of it a little bit earlier today, argued on this network that the Baucus bill would hurt the American people because the insurance industry would pass along any tax that it might feel, or any even lowering of profits it might feel in the way of higher premiums for everybody. It seems to me that Senator Grassley never runs out of objections. He did, in fact, help to write the Baucus bill. How would you characterize his work this year on this, and indeed of the so-called Gang of Six in its entirety?
I think when you look at their product, and clearly they tried very hard, a lot more needs to be done to make sure that you hold the insurance companies accountable. When politicians give speeches about how citizens ought to get the same deal as a member of Congress, they ought to look at this legislation and they'll see that millions of Americans won't get any choices at all, let alone what members of Congress get.
All right, so you at the last minute put in an amendment that everybody would get the right to select their own form of plan in an insurance exchange, and at 1:45 in the morning, the chairman, Mr. Baucus, told you that your amendment was out of order because it had not been scored, or in non-Senator language, not priced out yet by the CBO, the Congressional Budget Office. What was your reaction to that?
Keith, it was obviously a disappointing evening, but we're not giving up. The fact of the matter is, when you're taking on the insurance lobbies and you're standing up for the American people, there's a whole lot more of us than there are of them. They are slicing a fat hog. There's no question about it. They're trying to protect their profits. But if we can do what you started to do last night, which is to educate the public, make it personal, make sure that folks understand that what we're pointing for is the same kind of square deal that members of Congress get, we can win this.
Well, thank you for your kind words about that. It was not your amendment, had it not already been scored by the CBO? Was there some confusion on the chairman's part?
All I'll say about that, Keith, is we offered the amendment that had been scored by the Congressional Budget Office. They said it would produce savings for the American people. They said it wouldn't destabilize the employer-based system. What it was designed to do was to send a message that if you're going to turn the tables on the insurance lobby, if you're going to put the consumer in the driver's seat, everybody's got to have more choices. The way it works for a member of Congress, and frankly it's other federal workers, say the janitor at the Federal Bureau of Engraving, if somebody rips that janitor off in the fall of 2009, come January of 2010, they can get a better deal. You hold the insurers accountable.
Senator Wyden, will you be voting that finance bill out of committee, do you think?
I'm going to be spending my weekend, Keith, trying to improve it. We've got a number of days to go. If you and others will keep trying to educate the public. What you did last night was you made it personal. You showed people what's really at stake. If we can educate people between now and then, we can still get some more changes.
All right, amen. Happy to be of some small help. Senator Ron Wyden of Oregon and the Senate Finance Committee, a great pleasure. Thanks for your time tonight.
Thank you, Keith.